My name is Dr. Praveen Tripathi. I am a consultant psychiatrist and de-addiction specialist. Obsessive compulsive disorder is a common psychiatric illness. As the name itself suggests, there are obsessions and compulsions in this disorder. Obsessions are any kind of thought or any kind of image which is coming repeatedly into your mind. It is a thought which is usually senseless, and the patient understands that it is senseless. However, it keeps on coming in the mind. The patient tries to stop it, but he is not able to do so. And this thought produces anxiety. The patient becomes restless. He becomes uncomfortable. Compulsion is something which follows an obsession. It can be a mental act or a physical act. Basically, it's the hereditary predisposition. There is something in the genes which is making you predisposed to development of this disorder. And if you have that genetic component, there might be environmental factors which interact with this genetic component to precipitate OCD. There are usually multiple types of OCDs. The first is what is known as washers. The people who repeatedly have the thought that they are unclean, their hands are unclean, and they wash their hands or they bathe repeatedly. The second types are checkers. These patients have lots of doubts. The moment they go out of their house, they have a doubt that, did I leave the door open? Did I forget to switch off the air conditioner? These patients have these doubts and then they repeatedly go back and check it. Third type is what is known as predominant obsessions. These patients mostly have thoughts and no obvious behavior is observed. The fourth type of patients have a need for symmetry. They want everything to be placed in exact symmetry. If they have two pens, they want it to be at equidistant and at perfect angle to each other. And the last one is what is known as holding. So there are a group of patients who are not able to get rid of things which are not necessary. For example, a patient might come to you, he will say that he continues to have the class books of class 2nd, the school dress of class 3rd, things which are totally useless, but he is not able to throw them away. Somebody who has a family history of OCD, which means if you have a relative, a first degree relative like parents, brother, sister, or even a second degree relative like grandparents. We have two approaches. One is what is known as pharmacological approach. Second is what is known as non-pharmacological approach. So pharmacological approach basically means medications. So we have very good medications which can help in the management or treatment of the OCD, like serotonin reuptake inhibitors. Apart from the medications, it's very important to have non-pharmacological treatment also. So we have very good non-pharmacological methods, which is known as a psychotherapy method, popularly known as counseling. The most famous technique is known as exposure and response prevention. If you have any of the symptoms which I just mentioned, don't be shy, don't feel embarrassed, don't be afraid of anything. So if you have such symptoms, go to the nearby psychiatrist and seek help now.